to Aesthetic TV. I'm Stuart Brazell, coming to you from the stage of the Aesthetic Show. Today we're going to focus on the growing popularity of feminine rejuvenation, which is a non-scientific and polite way of saying procedures that are performed on the genital region. Until recently, all feminine rejuvenation procedures were surgical in nature. They are done in order to correct vaginal laxity after childbirth and for other medical and aesthetic reasons. Now, new non-invasive techniques can accomplish similar results without surgery. With the rising acceptance of non-surgical feminine rejuvenation, women can literally recreate themselves with the look and feel that is perfect for them. It's not quite like buying designer shoes, but it's close. You may be in your 30s, 40s, or 50s up here, but now you can be youthful down there with relatively little discomfort. Today, we're joined by Beverly Hills cosmetic surgeon, Dr. David Matlock. I like to call him the Dolce & Gabbana of feminine rejuvenation. Dr. Red Alinsod, a gynecologist practicing in Southern California who is the Gucci of feminine rejuvenation. And from Houston, Texas, it's Dr. Shelena Lalji, a gynecologist and cosmetic surgeon we call the Chanel of feminine rejuvenation. Thank you so much for joining us, everybody.
Great being here, Stuart.
So we're definitely in for an exciting chat. So I want to talk about, why is feminine rejuvenation done in the first place?
I think very recently we have all come to realize that women really need to have something that is well accepted, but also really needed. And so more and more we're recognizing this concern that women have. So as a board certified gynecologist, but also as a woman, I can definitely vouch for the fact that women's self-esteem is not only governed by how things are going on here, but also in other parts of the body. And now we finally are doing something about it.
It's definitely head to toe.
Absolutely.
Head to toe. You know, and also, and I think Red will agree that it's really a natural progression of what we see in cosmetic surgery. So first what you see, all of the surgical techniques, and then followed by that, we get some of the non-surgical techniques and the popularization of the non-surgical techniques. So I think where we are in this whole field of female genital plastic surgery, we're now moving into, in our armamentarium, this whole area of non-surgical feminine rejuvenation.
Absolutely.
Well, David and I started with surgical technique. It was always about the surgery, the surgeon's hands, but there's a large demand for going into something that is not as invasive, that can accomplish to treat all these women who are not quite ready for plastic surgery.
Right.
They just want to feel like their young self again without any surgery, and so that's where it's heading.
I mean, surgery right away, it's a little scary, and then when you think
Absolutely.
about doing it on that region of your body,
Sure.
non-surgical would be more attractive, I would
Absolutely.
think, to
And
most
then
women.
Think about no downtime, think about, doing something that really doesn't have the risk factors, and then getting the results that you really want so that you can look and feel the way that you really want to feel.
Yeah, but I think that it's important. I think that the panel will agree that this is really pretty much in its infancy. It's really in its infancy. It's growing. We have to bring the science in as well. Research is being done. This is a natural progression of
Sure.
any type of new procedures coming about in this particular field. So I think we have to understand too that it's not for everyone. If people say, well, is the surgical procedures going to go away? No. So I think it's very important that we really select those patients and be very selective, just like on any type. You say, oh, there's some non-surgical things that we do on the face. But some people, I mean, if it's so much relaxation and sagging and so forth and everything, they're going to need a surgical
You
procedure.
need surgery.
So we have to be selective on this.
And we're getting blown away every time we do these non-surgical treatments. For example, radiofrequency. David and I do radiofrequency therapies. And over the past couple of years, it's just amazing. We started doing it for vaginal tightening. That was our goal. And then we find out, oh my goodness, it helps improve vaginal moisture. And oh my goodness, the incontinence and leakage goes away. And oh my goodness, the overactive bladder goes away. And then the holy grail, our orgasmic function has improved.
Yes.
It's crazy what we've learned over the past couple of years.
Absolutely.
Well, it is exciting, at Aesthetic TV, we always like to talk about what's on the cutting edge, so it's
Yes.
great that this is what's happening right now.
Absolutely.
So talk to me on the medical side of things. What are some of the most common reasons someone would look into having this?
Well, as we have a growing population, of course, you definitely know that with menopause comes a lot of different concerns. So you have hormonal imbalance, you tend to have symptoms of hormonal imbalance physiologically, like hot flashes, night sweats, vaginal dryness, atrophy, symptoms of dyspareunia, which is painful intercourse, stress urinary incontinence as the collagen is getting older. When you have childbirth, there's a long list, and a lot of it impacts women on so many different levels. So when you speak medically, you just have to look at all the things that women are going through, and now we're really trying to focus in on what can we do about it, non-invasively, non-surgically, and surgically if we need to do it surgically, but really impact these women's lives as well as their partners' lives in addition to that.
And I think if women, they say, well, what can you do with these technologies? What are some of the most requested things? In my labia majora, they're relaxed. My labia minora are relaxed and sagging. It looks old. The mons pubis is relaxed. So a lot of these treatments start with the treatment of those areas of the mons pubis, the labia majora, the labia minora. And then now we're progressing to go internally and let's help because we have the surgical techniques for patients that I have vaginal relaxation, sexual function, or sexual feelings, it's diminished. So I want this tightened. So now we're moving into those particular areas as well.
And that really affects a person's confidence.
Oh, absolutely.
Their self-esteem.
I think that there's a lot of literature out there that we see that supports this as far as vaginal, as far as the vulvar structures, and it enhances the woman's self-confidence. These are good things.
Huge.
Yes, and when you evaluate a woman, they're always telling you less than what they really are there for. And you have to, as a doctor, read between the lines. And maybe they just came in because their labia majora are loose and saggy. But it's really because they're not having a satisfactory sex life, or they're ashamed to tell you that they don't feel anything, they're not orgasmic. And so these are all things that can be handled non-surgically now with the advent of new technologies. So it's an exciting time for the women of this world.
And I think it's important for practitioners to actually ask the questions. Just like Dr. Alinsod said, a lot of women won't come out and tell you. And so if more and more practitioners will open the conversation and be able to make the women comfortable, to be able to bring it in the open.
They're nervous. They're
Absolutely.
They're stressed.
Oh, they want to talk about it, but
they don't know how to do it.
It's scary.
Yes, it is. It is, definitely.
Yeah. So it's good that you make them feel comfortable. And so we've talked about some of the medical reasons, and then of course there are the cosmetic reasons, or maybe we should call them the desires. So these new non-invasive procedures, they not only improve the vagina's aesthetic appearance, but they also improve the physical sensations, orgasm, so it's like a win-win, right?
Yes. Absolutely. It's all of the above, and we're very fortunate to be in this time that we have procedures available for all of those areas of concerns, because ultimately, if it affects their self-esteem, it affects their relationship, and then it's going to affect every aspect of their lives. And we know how symptoms such as anxiety and depression are really increasing. This is a large part of why women go through those symptoms, and I believe that that will directly impact how women feel about themselves.
And I think this will go the way how things have gone with our female genital plastic surgery, female genital cosmetic surgery, where the women see it, they understand it, we get more information out there in the scientific community, in the public, the public, so that for the awareness, and patients are coming in. So they're coming in now and asking and inquiring about these procedures now.
Great.
And there's almost a domino effect. For example, you have one domino, and maybe the patient comes in just complaining of they're feeling dry down there. And so this first domino, and you knock down with a treatment, whether it's laser or radio frequency, you find out that you tighten the area, their self-esteem goes up. They look for something more satisfying. And then the next domino falls down because now they're moist, they have more desire. And then the next domino falls down, they're getting vaginal tightening effects from the treatments that are given, and their orgasmic changes are improvement. And these patients, treating them non-surgically, are quite happy because they didn't have anything invasive, they didn't have any knives, they didn't have any downtime. So it's like taking care of one thing and the rest follows. It's really gratifying.
You're going to get a lot of phone calls from happy husbands probably as
That's
well.
right.
So what are some of the new non-invasive feminine rejuvenation procedures, and how do they differ from surgical procedures of the past?
So obviously there is a lot of different technologies out there. There's radiofrequency, as the doctors mentioned, there is CO2, there is erbium YAG, and there are definitely good things that we can say about every single technology. Everything brings different things to the table. So with non-invasive technology, you can address the vaginal dryness, so atrophy. So you're really stimulating the mucosa so that you actually have the sensation of vaginal moisture that you did in your younger years. You can also do the different procedures to tighten the vaginal canal, which is great for sensation, sexual pleasure for both the
And if you've had kids.
Oh my goodness,
that's gotta be
exactly.
huge.
It's a huge deal, as well as with orgasmic potential. Some women just either have never had orgasms or no longer can achieve orgasms. So those are some of the things that are really great that we can do, along with, of course, the incontinence issue. And so many women suffer from that. So those are some of the wonderful things that we can do.
You know, I think that we as surgeons, we kind of gravitate towards our particular device that we like. You know, I mean, and that's just how it is. You know, that's how it is. And so, I'm partial to the radio frequency. I mean, with red as well. But we had a wonderful symposium yesterday on this. A lot of people there, a lot of doctors throughout the nation were coming in and talking about these things.
That's a packed audience,
A packed
right?
audience, and even international doctors. So, it's very important. It's important for the doctors to be able to look at the technologies and understand the technologies and understand what the different technologies can do, and for them to kind of make up their mind of which way they want to go. And I think that one thing I look at Red and I saw is that he's looking more to working on the complete person in this. I'm looking at the labia majora, labia minora, mons pubis, and ultimately into the vaginally. But I said, well, look, he's thinking about the sexual feelings. He's thinking about orgasms. He's thinking about, these kind of things. And when I look at him and what he's doing, it's really about the complete person. It's very interesting. Very, very interesting. Rick?
Well, you have to look at it as a complete makeover down under. It's the whole thing, and it's just not just using your aesthetic eye, but your personal sensitivities in helping the woman achieve what she wants to achieve. The lack of intimacy, or the, it's hard to put your finger on it. It's just they're not feeling sexy.
Well, they don't want to be in a bikini probably
Right.
by the pool.
Right.
Yeah,
exactly.
they've lost that swagger.
That love and feeling.
That love and feeling. And so I think as a surgeon or as a doctor, I'm sure David and Shelena will agree that, there's a lot of stuff underneath their message that we want to address. We want to make them feel whole again, and it's not just about the surgery. I've used it over a year and a half now, and this has been 10 years in design.
Wow.
Yeah.
So clearly this is very exciting, and I know there have to be some memorable stories. Dr. Shell, do you have one?
Absolutely. So many, but there's one that really comes to mind. I had a lovely 52-year-old woman who had just gone through menopause, but in addition to going through menopause and all the changes that come along with it, found out that her husband was having an affair. And so she ended up going through a pretty tough divorce. And here she found herself going through a lot of hormonal fluctuations, but in addition to that, finding herself out there again. And she had struggled for years with vaginal atrophy, dryness, as well as incontinence issues ever since she'd had her children. And came to me, initially her symptoms were, of course, the menopausal symptoms, and a lot of times that's the first thing that they'll talk about because it's more comfortable.
Yeah, they're more comfortable
Exactly.
to say, okay, I'm going through menopause.
Exactly. And sitting and talking to her and really trying to identify what her concerns were, a lot of it was with her vaginal concerns as far as vaginal dryness and painful intercourse and incontinence issues, as well as just not being able to have an orgasm. And this, she felt, had a big impact in how her marriage ended up. And so it was quite a heartbreaking situation, but it's not unusual. This is something that we see all the time. I'm sure the other doctors can agree. And once we conducted some of the procedures, got her hormones balanced, did something for her vaginal atrophy, she started feeling more youthful again, and actually did a G-shot on her that Dr. Matlock came up with. Thank you, Dr. Matlock. And she just felt like a new woman. Her self-esteem, her just even how she looked on the outside, it was just a change of life.
And she can find new love.
Absolutely, absolutely. And she felt confident to do so. So it was just a life-changing experience for her.
And Red?
Amazing stories. I'll just share a couple of really brief ones. I had a menopausal lady who's 52 years old, had been anorgasmic for years and completely dry. She'd been menopausal for close to a decade. So after one treatment, she comes back to see me and says, Dr. Alinsod, I'm a rainforest down there. And so that was so great for her. Yeah. And after 5 years of not being orgasmic, she was with her partner in a very stable relationship, having orgasms. And that was so wonderful. The better story is a young lady I treated over a year and a half ago who is a professional dancer. She's an entertainer. And I remember when we first did her Thermiva treatment, to tighten her vaginal canal. She's had 2 vaginal births, wonderful young lady with a couple kids. One treatment, she comes back and sees me and says to me, Dr. Alinsod, I think I've had a complication. Is it a complication that now I can't get my vibrator in?
No.
She got so tight. We were all cracking up in the office. I did 3 treatments on here. She comes back a year and a half later, and her orgasmic changes were so wonderful. She said to me, Dr. Alinsod, it's almost unfair when I'm working and I'm doing lap dances. Is it even ethical that they're paying me and I'm the one having orgasms? It's a crazy story, but
talk about a job with perks.
Yeah,
job
exactly.
with perks and the enduring effects of these treatments a year and a half later.
Yeah.
It's crazy.
Well, these stories are incredible. I mean, I just imagine your patients walking in with this gorgeous natural glow.
Yes. Oh my gosh, they're excited.
Yeah.
They're so happy.
Well, thank you so much for sharing your stories, and thank you to our panel of expert physicians for coming on the show to describe this new aesthetic trend.
It's been a pleasure, Stuart.
Thank you.
To keep up with the latest in these and other procedures, be sure to check out our website, aesthetichtv.com, for updates. For Aesthetic TV, I'm Stuart Brazell. Stay tuned and stay beautiful.